All right, I'm going to walk you through how you can do just a simple self-mobilization of the ribs, so that way it can help kind of make it a little bit easier for you to work on your diaphragmatic breathing, especially if there's a lot of stiffness in the mid-back area or just around that midsection of your trunk where the ribs are. So for this, you can use like a rolled up towel. I'm using a bamboo pillow. You can even roll up like a yoga mat. But what you want to do is you're going to take your pillow or your roll and you're going to lay on your side. You want to make sure that when you lay down, we're going to lay on top of this pillow or your roll, and we want to make sure that it's going to be up against the bottom of the rib. You don't want it too high because these are part of the stiffer part of our ribs, so we want it into that lower section of the lower ribs, okay? So we're going to start off by just laying on our side. And what that's going to do is this is going to kind of push our ribs upwards. And my knees are going to be in a slight bent position. And then you'll notice that as you take that deep breath in, and remember, in with the nose, is that the roll or the pillow is actually going to force those top ribs open just because of the positioning, and there's no opportunity to expand where I'm laying on that pillow. So for the mobilization, we can just kind of lay here and just work on the breathing. It's still a good stretch. But if I want to add a little bit more, what I'm going to do is I'm going to take the palm of my hand and I'm going to place it onto the bottom of my rib. And as I'm inhaling, I'm not going to apply any pressure. I'm just going to let it expand. But as I exhale, I'm going to push the ribs down. Inhale, I'm going to release the tension. And then exhale, I'm going to push the ribs down. Now, I only really need to do this about 3 or 4 times to loosen up. This shouldn't really cause any pain or discomfort. If it does, please discontinue and check with your healthcare provider to see if something else is going on. It's just a gentle self-mobilization to help kind of open up the ribs. Remember, it's inhale, release the tension, exhale, and you're just going to press down. So think squish the ribs. You want to do both sides. And so that's how we can kind of work on some self-mobilization of the ribs. There is a seated version too, where what we can do is we can do in sitting, hands kind of in this like Pac-Man C position. And what you're going to do is you're going to inhale, no tension. And then exhale, pressing the ribs in. So we're going to create that compression on the exhale. So that way we get a little bit of extra movement into the ribs. And then on the inhale, we release the tension. So again, it's inhale, no tension. And then exhale, squish the ribs. And that's how we can self-mobilize the ribs, just to get a little bit of extra movement and to help decrease some of that stiffness that we might have so that we can maximize our diaphragmatic breathing.